You're welcome again. This is your friend, Not Solution. Let's talk about the risk of HIV transmission from a female to a male during vaginal sex or vaginal penetration. It is generally low with estimate of about 0.04% per sexual encounter. This translates to mean that roughly 1 in 2,380 encounters without a condom is possible. However, this risk can be higher in certain situations, such as with somebody that has multiple sexual partner, or if the HIV positive partner has a high viral load, that is, the virus in the system is still plenty, then the male circumcision can also play a role in reducing the risk of HIV transmission. So let's talk about the various factors influencing the risk of female to male HIV transmission. According to a study, the circumcision study suggests that uncircumcised men have a higher risk of acquiring HIV from female partners compared to circumcised men. Do you understand? Then, apart from that, there's something we call viral load. The higher the virus, that the amount of HIV, the viral load, the amount of HIV in the affected person's body's fluid, the greater the risk of transmission. That's why they said you should, practice safe sex. Then the number of sexual partners, having multiple sexual partners also increases the overall risk of exposure to HIV. Then other sexually transmitted infections, the presence of other sexually transmitted infections, STIs, can of course increase the risk of HIV transmission. So, and I want you to know that condom use, consistent and correct condom use, we do what? Reduce significantly the risk of HIV transmission. So you should know what safe sex entails before you remove your penis and or you zip up and you remove your zip. Other factors like the presence of cut or sores in the genitals and the use of certain drugs like those that increase blood flow to the genital can also play a role in increasing or decreasing the risk of HIV from female to male transmission. What are the important considerations? There should be pre-exposure risk. The risk per sexual encounter is relatively low, but over multiple encounters, the likelihood of transmission increases. Then something we call individual variability. The risk of HIV transmission can vary significantly